Today is May Day. We'd like to thank all the workers who, in various sectors, have made adjustments to the circuit breaker measures. In particular, we also want to thank the migrant workers, particularly those who are living in the dormitories. Many more precautions have been implemented to safeguard their health, and they have been cooperative. They understand the necessity of these precautions, and we very much appreciate them working together with the officers on the ground to ensure that these measures are properly adhered to. We are taking a comprehensive approach to manage the COVID-19 transmissions amongst our migrant worker population, in particular, those who live in dormitories. Our objective is to help them to stay healthy. About 3 weeks ago, I had explained the whole of government resources being mobilized. And today, the interagency task force is deploying nearly 3,000 staff across various functions. I had shared the three-pronged strategy. First, to contain the spread in dormitories that already had clusters. Second, to prevent the spread in dormitories that did not yet have clusters. And thirdly, to move out and test all the essential workers across a whole range of industries. I had also explained that we needed 3 key enablers in order to implement these strategies effectively. We needed the forward assurance support teams, and these are the officers who look after many aspects of the workers' well-being. There are now 170 fast teams that have been deployed. The second key enabler was a robust medical support plan. We put together a holistic system with on-site facilities at the purpose-built dormitories at all of them, and this was supplemented by additional medical posts to look after the workers that are outside of the purpose-built dormitories. We also assembled mobile medical teams in order to provide on-site support to the dormitories that are not purpose-built, but in any case, may also need special attention. The nationwide network of public health preparedness clinics and polyclinics have also been mobilized, and they are helping to ensure that the workers get adequate care and support. Of course, the safe conveyance of workers in order to have their medical needs attended to is also a very important aspect. So that was the second key enabler, making sure that we have a robust medical support plan. The third key enabler was roping in the dormitory operators as well as the employers to look after things like hygiene as well as providing the necessities to their workers. So this was what we needed to do. The interagency task force has gone about its work professionally with a clear focus on the migrant workers' well-being. In the first phase, it was about getting the basics right. And what that means is we need to sort out things to do with food, to do with hygiene, to do with the safe distancing measures within the dormitories. They include making sure that the workers continue to get paid even though they may not have direct contact with their employers. And very importantly for the workers, to still be able to remit money home because they still have families who depend on them. In this first phase, it also involved moving out more than 10,000 essential services workers, testing them so that they can continue to work safely. In addition, we made sure that the workers, whilst they are staying in the dormitories, they have Wi-Fi, they have SIM cards, and they can keep in touch with their families and with their friends. And on special occasions like the New Year, as well as the observance of Ramadan, we made special preparations for those. So we have taken care of all of these things in the first phase, all the basic necessities. In the second phase, it was about getting the medical operations right. The medical support plan was fully fleshed out, looking into the whole range of matters that would make it effectively implemented, and the infrastructure as well as the medical personnel steadily built up in order to implement this plan. And if any worker was unwell, they got the same care as any Singaporean would. We made sure of that. So now I've talked about the first phase and the second phase and what you try to get right in each of those phases. We must now get ready for the third phase, where it is about getting the recovery process right. Now, this will involve housing the recovered workers in suitable accommodation. This will be necessary so that we minimize the risk of recurring transmissions. Again, this will be an enormous challenge, and not just the logistics aspects of it. Many workers will be rehoused, and they will have to get used to new friends. Many employers will have to adjust to their workers being in different locations with new arrangements. We will have to develop new strategies to monitor the health of the workers. This is a very important aspect of the recovery phase. How do we monitor the health conditions of the workers and take prompt action if it is necessary to do so? I should add that it's not just what happens where the workers are housed. It is also what happens at the workplace. Even at work sites or elsewhere, the arrangements will have to change, and we will have to look seriously at how these workers can be kept safe if and when they are able to resume work. So the Interagency Task Force is focused on getting its job done right. The scale and the speed of the response is unprecedented, and it's critical that we get this phase done well so that work and business can resume safely when the conditions allow. So let us give them our full support.